My name is Danny Avula. I'm the public health director for Henrico and Richmond.
Danny Avula knew he wanted to be a doctor in middle school, but it wasn't until his third year in med school that he realized public health was his calling. The idea that where you live, your job, and your income could have a major impact on your health fascinated him.
The fact that some communities were healthier than others and some were impacted by culture and policy and access.
He, his wife, and their 5 children live in Church Hill, not far from some of the most impoverished parts of the city of Richmond. Areas that Avula says are the most vulnerable to the COVID-19 pandemic.
Because of the lens that we bring in public health about structural inequities and the fact that that means that African Americans in particular are going to feel the brunt of this disease more severely.
Avula runs both the Richmond and Henrico health departments. And similar to Anthony Fauci on the national level, to many, this doctor has become the face of the fight against the coronavirus in Central Virginia.
I was walking my dog the other day and 3 people, one driving by and 2 people I walked past, I said, "Hey, you're that doctor."
Avula has worked around the clock for weeks, often appearing on television as COVID-19 turned from a potential risk to a real crisis. So is this the biggest challenge you've ever faced in your career?
Undoubtedly. Yeah. I mean, there's never been a public health threat that has consumed me and our entire team like this has.
Much of that time and energy has been focused on the outbreak at the Canterbury Rehabilitation and Healthcare Center in Henrico's West End. With 46 deaths, it's likely the worst situation of its kind in the entire country. Going back to Canterbury, it seems to me, in listening to your public comments, you don't blame them whatsoever for what happened there.
I think we as a society are constantly looking for, the villain or the scapegoat in the situation. And I am just not sure that exists here. Them being on the front end, that occurring at a time where, we weren't making these recommendations to preemptively cohort staff or to isolate based on symptoms versus waiting for a diagnosis.
So far, Avula says there are outbreaks at 16 long-term care facilities in his districts, and that number is rising.
All of the standard practices we've used with other diseases, case identification, case contact investigation, training around infection control practices, like those things have worked with other diseases in this setting. But it's not working here.
For example, let's say you test 3 roommates at a nursing home for the virus, and 2 of them test positive, but 1 tests negative. You immediately isolate the 2 positives, but what about the negative? Where do you put them? Because it's possible they could have contracted the virus in the time it took to get a test result back. Avula says the answers to these questions are all having to be figured out on the fly.
But you can see, as you think about, where healthcare workers are working and how they're moving through different floors and on different units, that creates a really complicated puzzle to sort out.
Complicated indeed. And it's not something Avula believes is going away anytime soon. He's predicting a coronavirus peak in Virginia in early May.
We've got 2 months plus on the downside of that curve before we can really stop doing the physical distancing and stay-at-home guidelines. And so I really do think it's midsummer or later when we are able to kind of lift those.
Dr. Avula says he recognizes the economic hardships the restrictions are creating, especially for our low-income families. However, he says we do things as a society that are for the good of others. To that point, he is pushing for walk-up testing sites in certain communities starting next week.